Hello, good evening, everyone. This is Dominic de los Reyes. Let me put my video on so you can see. Hi, I'm Dominic de los Reyes, and I am the program coordinator for UPAC, Union of Pan-Asian Communities program for community health worker communication and outreach services. We provide COVID-19 education and information to residents of San Diego County, especially the Native Hawaiian, Pacific Islander, Asian communities more affected by the pandemic. And we try to give updates that are timely and really connect with the communities so they know how best to take care of themselves and others, so we can all get through this together, right? Today is a special community engagement session as well. We are hosting Miss Agnes Hyatt. I'm so sorry. How do you say your last name?
That's right. Hyatt. Yeah.
So she's a licensed clinical social worker, behavioral health therapist, and member of our San Diego County community. And Jeanette, if you would like to share a little bit more about our guest. Jeanette is our community health worker who works especially with the Filipino communities.
Yes, of course. Miss Agnes Hyatt is actually my previous boss when she's still with UPAC, with EMA's program. And again, first of all, I would like to greet a good evening to everyone. It's a great pleasure for me to introduce our speaker today, who is going to talk to us about taking care of our well-being in this trying time.
All right, one moment. I'm sorry to interrupt. I wanted to double check that our interpreters are visible on Facebook Live.
Oh.
Sorry to interrupt. Just one for the, how do we do this?
Yeah, I can see her.
Okay, it's working now. Wonderful.
Yes.
Thank you. Please continue. Sorry to interrupt.
No, it's okay. Yeah, I can see. So again?
Yes, please.
Okay, so again, good evening, everyone. It's a great pleasure for me to introduce our speaker today, who is going to talk to us about taking care of our well-being in this trying time and in the new normal. This is a presentation in which we should all be deeply interested, because what we will be learning today are action to cope with stress in a healthy way that will make you, particularly each one of us, the people we care about, and the community to be stronger. So tonight's speaker is a former UPAC employee as program manager for EMAS. EMAS stands for Elder Multi-Access Support Services. At present, she is a behavioral health therapist with health therapy, survivors of torture, and Provident Home Health. She also provides psychological consulting services with AmeriCare Adult Day Healthcare Center and Mollison Adult Day Healthcare Center. In addition, Ms. Hyatt enjoys providing community service through Kalusugan Wellness Center and License to Freedom. So without further ado, I would like to introduce to you Ms. Agnes Hyatt, licensed community social worker.
Hi, good evening, everyone. How are you all? Is this a coincidence that we scheduled this town meeting on this historic day? We know today is the formal change of our government. Or am I just lucky? By the way, thank you, Jeanette, for invitation, and to UPAC for this platform to be connected with you all. How great to end this day with this topic I prepared for you. I presented similar topic last year with our fellow Filipinos in the Philippines, also through webinar. As you know, we are all in the same situation. As human beings, we probably feel and think the same way. Fear of being affected by this pandemic, fear of the unknown, and fear of where the future would take us. As we probably wish that this pandemic would now end soon. But as you may already have heard, and I heard it when Bill Gates was being interviewed, and he said that in reality, our situation will not go back to pre-COVID situation. So knowing our reality, what we can do and how to cope with this trying time and the new normal is as what you've been hearing. So before I proceed with my presentation, I would like to inform you and give my disclaimer. The illustration you will be seeing in my presentation are borrowed from the authors, experts, or researchers stated in the slides or the organization. I consider myself not an expert, but more so as a practitioner. I try the strategies I will be presenting to you tonight. And in doing my self-care and in working with my patients as a behavioral health therapist. So I know it works for me. I know it works in many of my patients, and I hope it will also work for you. I mentioned trying times because I believe everyone is trying their best to thrive, stay healthy and well, be connected with their loved ones and friends. So first, I would like us to take a look at what well-being means to us. So based on materials I gathered, let me say, well-being is the experience of health, happiness, and prosperity. It includes having good mental health, high life satisfaction, and a sense of meaning or purpose. So well-being emerges from your thoughts, actions, and experience, most of which you have control over. So knowing that this is the meaning of the global definition of well-being. So as you notice, most part of our well-being is our mental health. That's why in this pandemic time, we've been hearing that a lot of people are experiencing depression, anxiety, and they being affected by their past trauma. So how to cope with it and how to be able to adapt our situation in these current times is the focus of my discussion today. So I got this basic life principle because once we get the whole picture, this probably help us adapt ourselves in the situation. So this is based on the acceptance and commitment therapy that I got from Dr. Elmira Strange, that whatever we're experiencing is a normal experience of being human. What we are going through with various emotions, having negative thoughts, having low mood, deep or dark emotion and feelings, that's part of our being human. Our thoughts are not necessarily facts, however, and it's not necessarily the truth. Thoughts are bit information of the information in our inner dialogue. So knowing that thoughts may reflect your own opinion, the self-criticism, memories, but not actually accurate or helpful. So most of the time, because of our experience, we went through a lot, especially if our age is already, we've been here for a long time. So there's a lot of experience we gathered in our past life, and it all goes down to our subconscious. And this is as what you probably heard from other researchers and experts. They said that, especially I will quote Dr. Bruce Lipton, he said that 90% of how we behave is based on our automatic thinking. So it's more on our automatic habits. So why it's very difficult for us to adapt in this current situation? It's because we are used to our old habits. So old coping strategies like suppressing what we're feeling, negotiating with thoughts that doesn't work, like, oh, I hope this is gonna end soon, I want to go out. And these things, knowing that it's our habit, it really affects our mood condition, because once we are like fighting or with the reality, the tendency is a distressful situation. So willingness and acceptance is the key to one's emotional state. Being in contact with the present by practicing mindfulness, a tool for managing our emotions and rumination, might help adapt in the current situation. Identifying our values can aid in our emotional regulation. Now, what is important to us? Is it going out with friends or being safe? Is it going to be safe to use masks, wash our hands, maintain social distancing or physical distancing, or still getting used to the habit of doing things which might not be any more effective for us to keep our situation. So identify values important in our emotional regulation, and accept that suffering is an inevitable part of our life. So I have these slides for us to understand and have it as part of our template. The important part now is awareness. We have a lot of time already in our hand. And we've been busy. We've been busy doing things in the past. We've been busy interacting in our external environment. But we didn't have so much time before COVID or before this trying time to go back to our inner system. So this is the time for us how to be more self-aware in our own behavior, that we'll be able to adapt in our current situation, in our current reality. So when seeing this pyramid, which is the level of our awareness, it shows that when we are still in the lower level of our awareness, that our automatic system is to fight or to flight, react instead of responding. And then in our action, we follow. So what we hear from the media, we believe everything. And then eventually we see that, oh my goodness, where am I going to go? So it is important in this level of our awareness to be more intentional, to know what is our behavior, to understand why we are doing what we are doing. So I included the 7 levels of personal consciousness because it's also the time when we do our self-reflection, knowing where are we right now? Am I still in the survival? Am I having an issue with my relationship? Is it because of my self-esteem that is being challenged? So being conscious of where are your soft spot or where other people are pushing your buttons will help you able to respond to the situation and able to be socially engaged. As what you have heard, many of the families, because they didn't have the chance to go out of their homes, most of the time there are a lot of friction in the house, right? So it's a question of how am I gonna work on my relationship, a healthy relationship within my family circle, knowing that possibility the members of my family are not feeling safe too, are not being loved, are not being protected. So those things probably in your consciousness might be the focus of your activity and your plan for the day. So this is just an extended illustration about the personal consciousness, level of consciousness, and it's divided into your service to yourself, service to your society, to your community, and the global sustainability. So knowing where we are right now and understanding what are our needs and our wants. So we want to go back to our internal resources, building that, strengthening our inner strength might probably help us, or definitely will help us, relate to our external environment. Working on our values. What are our beliefs? Who am I? What do I want? So those things, once you are ready with that, that will really help us adapt and cope with the changes in our external environment. So why do we need to understand the levels of awareness? Because probably who does not want to have good quality of life? We want to improve our quality of life. We want to enable ourselves to grow better. So it's about personal growth. It's all about helping other people, giving you a better understanding of other behavior. So that the interaction and then the social engagement will definitely help if we know who we are, what are our values, what are our beliefs, and how we can relate with others and understand the other's behavior. Giving feedback on the distance between where you are right now and where you want to be. So I brought up these slides to understand the 3 aspects of our mind. So we have this rational mind, which most of the time we know that this is our IQ. Good in academics, good in reasoning, good in problem solving, good in a lot of things in decision making. However, part of our mind also is our emotional mind, which is our emotional intelligence. How are we going to respond to the situation instead of reacting? So, knowing our life and our reality, the question to ourselves is, am I reacting because of my emotion? Or am I just being true to myself? In between that is what we call wise mind. It's more on understanding the whole situation and bringing that wisdom, the insights that we learn from this situation. For example, because of pandemic, I heard from other people that they're able to practice their gardening skills. They're able to do a lot of things with their hands. They're able to bring the best in them. So that means this situation is not, if we look at the other side of it, there's a lot of things that we're able to discover what we can do as a person, as human beings, as a community, and as family. So I got this from Dr. Friedland, and I like the way how he presented the idea of managing stress. And he calls it he calls it 4-in-4 framework to lead well from within. So it's more about going within our internal system. We notice when we are anxious, we're not able to think better. When we are scared, we're like in our fight and flight mode, right? Most of the time we cannot understand the other person, but we try to defend ourselves. So we are in that category of the part of the nervous system that we are fighting it or we fly. When we are able to calm down ourselves, when we are comfortable in our own body, as we connect to our own body, then you notice that your creative mind is working. You're able to be creative. You're able to find a way to address the boredom in this situation. So how to do it? The way how we do it, and I practice with my client, is very simple breathing exercise. But breathing exercise, sometimes they said, that's all? That's just like that? No. So we have to practice. As I mentioned earlier, we have this habit that 90% of our behavior is automatic response to the situation. It's a reaction of our previous experience, previous trauma, previous dialogue in our thoughts. So to be able to be in the present, we have to focus on our breathing. Then it brings us to connect in our body. So how to breathe? We know how to breathe. This is how you call this, normal. This is automatic. Nobody can tell us, breathe now, no. So, but there's the way how to breathe right. And there are some exercises that you probably want to practice also, like When you're feeling anxious, you do the exercise like you breathe in one on your right nose. Inhale, bring the air in on your stomach, and then exhale on your left nose. Inhale, exhale. Inhale, exhale. Notice that your body sensation is helping your mind to calm down. And once our body is calmed down, then we are activating our right brain, which is our creative mind. So here's the way how Dr. Daniel Friedland advised us. Recognize and manage the reactivity, which is the fight and flight. Then reappraise your stress and self-doubt. Where is that coming from? Why am I acting this way? What am I afraid of? What is it that make me react this way? So, and then once you're able to bring your consciousness or your attention in your present situation, then that's when you help your mind cultivate that creativity. And then eventually it helps you to catalyze your own personal growth. So I know this is a forwarded messages and I like it. I like to collect a lot of forwarded messages. So this is something that might help us in bring this template. Where am I now? Who do I want to be during COVID-19? Do I want to stay in my fear zone? Do I want to be in my learning zone? Or am I now in my growth zone? So knowing this information help us in our reflection, help us understand our situation, our condition, our personal strength, and then how to become intentional, and then how to adapt in your present reality, how to adapt in your current situation, and where am I gonna lead my life, the life I want to be. So 2 words I want you to remember. One is be intentional in your behavior and in your thoughts, and then it affects your emotion. It changes the chemistry of your body. Be intentional, how to self-regulate, and how to adapt in our current situation, wherever you are. So important to remember, take responsibility, be part of the solution, keep calm, and be part of the solution too. So that's things that we wanna go back and bring into our awareness. So this presentation, the homeostasis is a dynamic balance between the autonomic branches. This is what we are aiming for, how to stay balanced. To stay balanced is more on how you connect your mind, your body, and your heart. Align them. And then be aware of how your body is, body sensation is. What is it telling us? What is it telling you? Identify the emotion that's attached to the sensation. And try to accept, I'm angry now. It's okay. It's okay to be angry now. But I don't want this kind of behavior. I want to be a nice person. I want to have healthy relationship. So when you're hearing that, I want to instead of I don't want to, then that helps us help you know what you want to do. So what is important is the process. Remember, as human beings, it requires process. It cannot, whatever you want, you cannot do it immediately. Or you cannot achieve that result. What is important is how you do it to achieve your desired outcomes. So as I mentioned, I'm good in collecting forwarded messages. So I got this, and it's a nice information. I kept it, and I keep on reminding myself too. So coronavirus has killed a lot of people, but I am still alive, and I'm still alive. So I'm thankful for this gift of life. So when you cannot control what is happening. We challenge yourself to control the way you respond to what's happening. That's where your true power is. That's where our true power is. So sort things out. What are the things that I cannot control? What are the things that I can control? So what are the things that I can control is my behavior. What are the things I can control is how I respond to the situation. What are the things that I can control is the arrangement of my home, my decision to be better, my decision to find a way to progress. What I cannot control about the political situation. I can participate in this decision making. I'm a voter. I can vote to the person I like to vote, which I think will run the country better. I can participate in signing a petition, but I cannot control what is going on up there. So fear does not stop death, it stops life. And worrying does not take away tomorrow's trouble. So why worry, right? So how do we practice not to worry? Accept that we are worried. Do our breathing exercise, calming exercise. And then how to distract our attention with the worries that we cannot solve right here, right now. And how to be in the moment. How to be mindful in our immediate environment. And how to practice it is usually, probably a lot of people knows about it. How to bring your mind in the present. Name 5 things that you can see around you. So 5 things. I see plants. I see my statue there. I see table. I see chairs. Then name 4 things that the sound that you can hear right here, right now, for sound. Then 3 types of smell that you can smell. And then the texture, 2 types of texture and the sense of taste. So we practice challenging our 5 senses. So sense of sight, sense of hearing, sense of smell, sense of taste, and sense of touch. That's how to practice to be mindful and in the present time. And then start being intentional. What am I doing? Am I aware of it? What do I want? So where do you go from here? So Explore what's stressing you. View your situation with positive eyes. Find what you can change. If you could not, if you could, what part of the situation would you most likely to change? With positive reframing, you may see possibilities you weren't aware of before. Like as one of the example I mentioned, I didn't know that I'm good in gardening. I didn't know that how to take care of plants. Now I know how to take care of plants. And then it gives me some fulfillment and I forget my boredom. Identify benefits. Find the benefits in the situation you face. Like for instance, now it's a trying time. I lost my job, but actually I got a good job of being I stay in the stay at home order. I'm able to do my telehealth and then discover the humor, not rumor, discover the humor and find the aspect of your situation that are so absurd that you can't help but laugh. So a lot of times we are laughing about the mask. Many people, when you see these people with masks, they thought they're in their mask, but you look at them, the mask is already below their mouth or their lips. So don't expect that that we are going back to the previous situation that we can no longer wear masks. I got my immunization, my vaccine, but still I have to protect myself. And we know a lot of people already died, and this, according to the census and the report, this is the highest the cause of morbidity in the nation. And I'm happy to hear that our new president is able to recognize and give memorial to those who lost their families. I feel bad about it because I have friends who were affected by it, and I have some friends who died because of it. So we try to be helpful with each other and to follow the protocol, to follow the safety instruction, and hopefully we will all be safe and able to get through this. So that's all for now. Thank you. I hope I gave a little of my 2 cents. And as I mentioned, when in this situation, first thing we want to do is how to regulate our thoughts and feelings so we'll be able to think better and be intentional in what we really want in our life. What we need is how the old habits that is no longer effective be replaced by the new habit that will be more helpful and healthy for each one of us. Thank you very much. Any question?
Hi, Miss Agnes. Thank you so much. Again, this is Dominic. I'm the program coordinator of the Communication and Outreach Services program at UPAC. Really appreciate the presentation. Just want to help facilitate directing some of the audience questions to you. Here on Zoom, there's a question in the Q&A box. I'll read it out loud. And also, sorry, I'm not on video right now. It's so that viewers from Facebook can see the interpreter. The question says, thank you, Miss Agnes. I came in a little late, so apologies if you already covered this. My question is, I feel like everyone is talking about needing to connect with others and feeling the hardship of not being around people. I am an extrovert, and I am actually having the reverse problem. I am struggling to want to talk with others. I feel like maybe I became more introverted during the pandemic, and meeting with people feels exhausting. Is this normal?
Actually, that I can relate with you because I'm also I identify myself an extrovert. I am missing parties and surrounded with people, and I could imagine what we went through. It really changed our habits. And I even mentioned to myself too, like, am I becoming introvert? Not necessarily, and it's okay. Okay, so going back to the pattern of the thinking that we have. So the question to ourselves is, do I like it? Am I comfortable in my own body? Am I comfortable, or I am in distress? So you want to communicate or connect with your body because our body is giving us a lot of signals. If we are uneasy, find out what is that uneasiness that's affecting us. And work, as I mentioned, self-regulation. So we want to first calm down ourselves so we'll be able to activate our creative mind, and then bring it's time for us to reflect back and knowing, like, who am I? What do I want? What I value now with this change in my external environment and my belief system? What is it telling me? So the important part is you knowing yourself, knowing what you value, knowing your current belief, because belief can change depending on the situation. And as Bruce Lipton also mentioned, whatever you believe, 100% without a doubt will happen. So, and then the way how we manage our emotion, it changed the chemistry of our body, and it's affecting our immune system. So what is important is how to take care of ourselves, making sure that we're helping our body to maintain that immune system. And it starts from here, goes down to our toe, which is the one grounded in this space, right? I hope I answered the question.
Yes, I marked the question as answered live. Thank you so much for that. Any other attendees on Zoom or viewers on Facebook? Do you have questions for Ms. Agnes? Feel free to either type them in the chat or the comments. You can also turn on your microphone, I believe, and say it if you're more comfortable that way.
I saw a question here from Anonymous. I am struggling to focus on work and feel overwhelmed with all the tasks I have to do. Can you share some advice to get motivated instead of shutting down? Oh, when I am feeling overwhelmed to get a task finished. Okay, so when we are overwhelmed, the first thing we have to do is to stop doing what we are doing. Because the more you push yourself, you are in your sympathetic nervous system. So the more you push yourself to be more overwhelmed, the more you cannot think. So the first thing to do when you are feeling overwhelmed, stop. And then connect with your body. Okay, how to connect with your body? Your mind is working too much. As I mentioned before, the slides, it said, like, our thoughts is not our reality. It's part of our history that is stuck in our subconscious mind. So what we first thing to do is to bring your attention and your focus in your present. So you do your breathing exercise. Okay, so I practiced earlier one of the breathing exercise that I usually practice with them. So inhale, like using just nose. Okay, so inhale on your right side of your nose. Bring the air in your stomach. That's deep breathing. So exhale on your left side of your nose. Slowly inhale, exhale. So with that, you're helping your body to calm down. Once your body calms down, it's like a machine, like your internal system, once you are overwhelmed, it's not functioning right. So you try to calm down so that your internal organs will function normally, especially feel your heart. Go back to your heart. Hold your hand, your heart, your chest as you breathe in. This one is another strategy. So inhale through your nose, exhale through your mouth. Shift your focus in your heart as you're holding your chest. So inhale, exhale. Inhale, exhale. So you're feeling your heart and trying to regulate the heartbeat. Once you held that 3 minutes only, then that will help you regulate your emotion, and you're able to activate your parasympathetic nervous system and activate your creative mind. Otherwise, you cannot think, it will shut down. It's like, they say it like you become a caveman. All your system shut down. So you don't want that to happen. 3 minutes of your time will give you what you need to do. And then you organize the task that is in your hand. So I have a hard time motivating myself to expertise and take my meds. What do you suggest? I am having a hard time motivating myself to
Probably exercise.
expertise.
Yeah.
Exercise and take my meds. What do you suggest? Okay, so yeah, to exercise. Okay, so motivation starts from you. If you know why, then your body will follow you. So it starts with your reflection. Why do I need to exercise? Why do I have to take my medication? Okay, so work on that. What do I want? Why do I need to do these things? So when you know why and how, then exercise and taking medication, which is what is easy to follow. Your body will follow naturally. Okay, so I go back to the concept of self-regulation and be intentional. Exercise help our body to produce the necessary chemicals that is needed by our brain. Remember, our command system is our brain. So we need to make sure that our brain is healthy, so that we will have a healthy mental health. If our brain is not receiving or not getting the right chemicals, neurotransmitter, then whatever you want to do, you cannot think right. You cannot behave right. So what are the neurotransmitters that are needed? Serotonin, endorphin, dopamine. Why serotonin? Serotonin is the chemicals that help us feel good, happy. Endorphin gives us that energy. And dopamine helps us to move, right? Or do something. So these are the necessary chemicals. Why exercise? Because when we exercise, it will help our body produce this neurotransmitter that will bring to our brain, and the brain will function normally, and our mind will be able to think appropriately. Medication is a supplement, actually. If we have these mental health challenges and our body is not able to produce this kind of neurotransmitter for our brain, then we need medication. Medication balances and gives us enough not nutrients, the chemicals that is needed for us to function as human beings, to behave appropriately in our external environment and in our internal environment. That's why we need a number of times we need medication to keep us going. So if we know that, then it's easy for us to be motivated and be intentional in our day-to-day activities. Any other question?
Should we expect from this office?
Hello, Agnes, is Ellie.
Oh, Mr. Ali, good to hear from you.
Yes, well, I'm glad I'm participating.
Yeah.
You just talked about motivation, but in the light of the current pandemic situation, how about talking about fear and worries? Because right now I hear a lot of seniors talking about their being afraid to take the vaccine. And this is mainly due to the fact that news media are sometimes just propagate news that are more negative than positive. That they're talking about some recipients that become sick due to the vaccine and all that stuff. So these are things that are beyond their control.
Yeah.
Now, how should we address that issue?
How to address that issue? Good question. Good question, Manong Eli. Actually, accept that we are wired to worry. We are wired to be fearful. That's how we were wired. We went through a lot. We went through a lot of trauma. We went through a lot of not so good stories of our life. But the important part here is we have to be informed. We have to be informed and then make a decision. Okay? So weigh the benefits. Okay? So, what are we worried about? We want to know that. And then, who am I? What am I? What do I want? And then, what do I value? And then, what are my beliefs? So, knowing these three things, and then make an informed decision. So, like for example, I will an example. I have already the vaccine. Okay, so what are we fearful about the vaccine in the first place? Can you tell me, Mr. Manong Eli, what are we fearful about the vaccine? The injection itself, what
Yeah,
it is?
I don't have any fear at all in taking the vaccine, but I'm talking about other people. And the problem is that there are no groups that are trying to address this issue, trying to provide the correct or the truth as we know it. They hear more those sides that are propagating the
Right.
That's the problem. There are no groups that are trying to counteract any of these campaigns that are going on.
Yes. So we want to sort the what are myths, and what are facts. So I posted in Facebook. It came from UC Davis. I got it from License to Freedom Facebook information. Very informative. It says there the myths, and then they put the facts. And then saying, like in my case, I said, what is vaccine for? And what is it all about? So the vaccine is actually your antibodies to protect you from COVID virus. So I wanna, take the risk. There's no 100% perfect. I know that. That's my belief, that there's no 100% perfect. But I know that this vaccine has been tested. I know they mentioned that it's not 100% accurate, but at least 80% or 90%, I don't know exactly the percentage, is effective. So weighing the situation, I want to take the risk. So the bottom line is you are an informed decision maker, and you decide for yourself. What do you want?
Yeah, I agree with that. More action should be taken of this and that nature. That more information to be disseminated.
Yes.
But I don't know of any group that are doing this.
There are already groups, but I'll send you the slides, and probably you will be one of the group that can spread the word and help them to make decisions and take responsibility in their own action. That is very important. How to take responsibility of our own well-being, how to take responsibility of what we want in our life.
Yeah, that's exactly what I have been doing with the available information that I've been receiving. And because just today I received information that they have already expanded the eligibility of those that are to take the vaccination to include 75 plus. It's good news.
And when, this is the thing, if you believe that you are not going to be well, you are not going to be well. But if you believe that you are 100% that this vaccine is going to be helpful to you, because of your belief, it's going to be helpful to you. That's the bottom line.
It will be helpful if you will send me to what you have been sending. So
Yes. But it's about the person. It's about the person, the belief system. If you believe 100%, without a doubt, then it will happen.
Thank you so much, Miss Agnes. Just because we're coming to the end of our time tonight, I want to
thank you.
inform folks of ways they can stay in touch with our program for more COVID-19 information as well. And we have a prize giveaway for those who signed up through our Zoom for the Zoom link tonight. So I've entered folks' names into this wheel, a raffle. So let's spin it and see who will win a UV light sanitizing box for their all items, such as cell phones, keys. It's looking like Miss Felicidad is the winner. So we will mail this to you. Congratulations.
Congratulations
for attending this educational session tonight. Thank you, Miss Agnes. Thank you to our
my pleasure
team, Cindy Seto and Lori Bellama, our ASL interpreters, our live captioner by Anihan Guevara, our accessibility coordinator, Melissa Kelly Colibri. Thank you so much, as well to our community health workers, Jeanette and Tracy. You know, everyone who is helping the community get access to information to COVID-19 so they can be safe and well. We appreciate you all, and tune in February 5th to our next community engagement session. And until then, you can reach out to us online through Facebook or the UPAC SD website. So thank you so much, everyone, and have a great night.
Have a great night. Take care.
Thank you, Miss Agnes. Good night.
Thank you. Thank you, Agnes.
Bye, everyone. Thank you.
Bye.